Well, thanks for joining us. I'm Victor Lopez. As you know, the COVID vaccine is being administered to people across West Texas. Many of you have already received your second dose, while others are still waiting for your first. Understandably, many of you have questions. The News West 9 vaccine team is here to get you the answers you need to make educated choices when it comes to the vaccine or the coronavirus in general. Now, many of you have asked or are probably wondering how the COVID vaccine was developed so quickly. Tatum Gwynn joins us with a brief explanation.
Most vaccines take years, even decades to develop. So how did we get a COVID vaccine in a matter of months? Good question. One of the biggest misconceptions about the COVID-19 vaccine is that its development started with the current pandemic. In reality, scientists had a head start. That's because COVID-19 comes from a family of viruses, including the SARS coronavirus of 2002 and the MERS coronavirus in 2012. Many of the researchers who are developing the COVID-19 vaccine had previously studied those similar viruses. They already knew a lot about what works and what doesn't. Scientists have learned how this family of viruses behaves, their biology, and the so-called spike protein, which allows the virus to enter our cells and infect us. When the pandemic hit, scientists already knew that if a person has antibodies that recognize this spike protein, this could stop the virus from infecting them. And that is the key to both the Moderna and the Pfizer vaccines. Each uses messenger RNA to construct the coronavirus spike protein. The immune system rushes in to defend against the protein, and you build immunity to the virus. Victor?
Well, thanks for that, Tatum. Let's go ahead and jump into the deep end, shall we? To help answer your questions, we spoke with staff from Medical Center Health System in Odessa, as well as Midland Health. We'll hear first from Russell Myers, President and CEO of Midland Memorial Hospital, Val Sparks, infection preventionists, and Dr. Lawrence Wilson, Vice President of Medical Affairs and Chief Medical Officer. And let's go ahead and get started. Several of our viewers want to know, can you get COVID-19 from the vaccine itself? For that, we turn to Dr. Wilson.
The short answer is no, you cannot. But a little bit more detailed, it's pieces of mRNA that produce proteins that are on specific surface markers on the virus that allow your body to develop an antibody against the virus. But it is not introducing a virus. It's not introducing anything that can be injected into the cell to produce the reaction that we get. So it's very, very safe. It's been now administered to millions of people, and there's been nobody who's gotten the virus from the vaccine. It does not happen.
Thank you, Doctor. Now, as you know, Midland Health does require anyone getting a vaccine to make an appointment in advance. Possibly one of the most asked questions that we get on a daily basis is, how can I find out where I am in line? With several thousand people on that list, there are actually a few ways you can do that.
At this point, if they have not been contacted for an appointment, we are asking that they please re-register through our website at www.midlandhealth.org/vaccine. Or if they do not have internet access, then they can call 2214-VAX. Now, there may be a wait on the phone line, but that is a direct line to scheduling, is 2214-VAX.
Now, in addition to that number, they have also set up an email address that is vaccine@midlandhealth.org. You can ask questions, ask that they confirm your appointments, or if for some reason you have not heard from them, they will respond to you as soon as they can. Now, you can also cancel your appointment with this email if you need to. Just be sure to give them enough time so that they can schedule someone else into your day and time slot. Well, here is a question that doesn't really deal with the vaccine itself, but the process. One viewer asks, there are rumors that MMH is asking patients for insurance information so they can file a claim with insurance. The feds say everything with the vaccine is supposed to be free. Can you check on this?
That is true, Victor. Just to be clear, we're not filing a claim nor charging anyone for the vaccine itself. But Medicare rules and many of the local managed care providers will pay an administration fee for the actual labor and supply cost of giving the medication. So for people who are insured or on Medicare, we're taking their information. We're not asking the patient for any money. We are billing the insurance company or Medicare and taking whatever they pay. So there's no patient payment obligation whatsoever. If we have a third-party payment, we'll gladly accept it because we're incurring tremendous amount of cost to deliver these vaccines. But where that's not available to us, we'll move on, and the patient will have no financial obligation whatsoever.
And that, of course, was Russell Myers. We're going to take a quick break now, and when we come back, we will answer more of your COVID vaccine questions. Stay with us. Welcome back. Before we get back to your questions, we want to share some generic or general vaccine information with you. Now, there are currently 3 vaccines available. First, the Johnson & Johnson vaccine. It requires only 1 dose and is 66 to 85% effective. Next is the 2-dose Moderna vaccine. It is 94% effective. And lastly, the Pfizer vaccine, also 2 doses required, and it is 95% effective. So now we turn to our second group of experts. We have the staff from Medical Center. We have Russell Tippin, President and CEO, and then Kristen Timmons, Chief Nursing Officer and Chief Experience Officer. Thank you both for joining us this evening. Now, as you know, Midland is giving vaccines by appointment only. We mentioned that earlier. Odessa, on the other hand, is not. A lot of you wanted to know why that is.
We really wanted to try to get as many as we could in the hours that we had set. And we knew if we did appointments, we would not be able to turn them in as quickly as we wanted to get what we did in a day, where you have 800 scheduled appointments compared to you can actually vaccinate 1,600. And we also had a little bit of concern of what if people don't show? We didn't want to waste vaccines because we really have done very well as an organization in making sure that we give everyone a vaccine that we've drawn up. We have wasted none. And so we want to make sure that we continue that. And we just didn't know that we'd have that guarantee if we did appointments.
Now, this particular question has been generating a lot of conversation. Many of you are asking if you can get the vaccine even when you don't live, or if you're not in the 1A or 1B group. Here is the answer out of Odessa.
And right now, we are vaccinating 1A and 1Bs are the priority. However, if somebody's in line and has registered and they're not in the 1A or the 1B, we're going to inject them anyway. So, I mean, so for Ector County, where you fall is where you stand in line on Wednesday or Thursday morning when we're giving shots.
Now, a viewer asked this particular question of interest. A viewer commented, if you have had Guillain-Barré syndrome, you cannot take the flu shot. Can you still take the COVID vaccine if you've had this or any other underlying health condition, even if you are in phase 1A or 1B? Kristen?
So as of now, the only thing that the recommendations come from the companies that are producing the vaccine is if you've had an allergic or an anaphylactic reaction to another vaccine, then they are asking that you not take this one. They have not broken it down into if you have A, B, or C, you can't take it. It simply is a very broad statement that says if you have already had an allergic or an anaphylactic reaction to a previous vaccine, then they advise you not to take this one.
Okay, now this question has come up quite a few times on our social media pages. Many of you want to know, why do I have to wear a mask if I have already received my COVID vaccine?
Well, not everyone has had the vaccine for one. And so we really have to continue our current practices, not just because of the mask mandate locally, but we're really following as an organization the CDC guidelines. And those guidelines have not pulled that mask mandate from us as of yet, because we do know some people have not had the vaccine. We still have to work to protect each other. We don't know which patients that come in have had the vaccine. And until we have that mass vaccination, we have to continue our current practices to protect each other.
Okay, now last Thursday, Medical Center gave out about 1,750 vaccines. Their total for last week put them at 4,250, which means that they've done just under 13,000 vaccines in the first 2 weeks of the drive-through at Ratliff. So you have to wonder, have there been any reports of serious side effects or reactions to the current vaccine?
Not that have been reported after they've left the Ratliff Stadium area. We did have to call 911 on one individual. I believe that was on Friday. No, it was on Thursday. I'm sorry. And so we got him taken care of. He came to our emergency room. He was treated and he was released home. So we just had the one that caused us a little bit more concern than just go home and take a Benadryl. And so that is one that we did report to the state.
Okay, so many of you have told us the vaccine is not available in your area. You've asked if you have to live in the city or county where the hub is located in order to get your shot. Ector County officials addressed it like this.
The state told us when they visited with us about getting this started is they want shots in arms, and they don't care where those arms are from. They don't want these vaccines sitting in a freezer. They don't want them sitting on a shelf. They want them in people's arms. And so, so definitely but we've had people show up from all over. We've had people from El Dorado, Del Rio. Kristen, you may know more about, you've been out there longer than me. What have you seen as far as where these people are from?
We've seen people from all of our 17 counties that we serve. We've seen them as far as El Paso. I had a couple reach out to me that their parents were here from India and that they would be here for the next 40 something days. And so we actually vaccinated them as well. So I think we've seen a wide range of people. And to Russell's point, our goal is to not kind of cipher through who and where you're from, but to just get you a shot. Because regardless of where you live, that shot is going to be important and it's going to impact you and your community.
Kristen, Russell, thank you for that. We've definitely covered a lot of ground so far, but don't go away. We'll be back with more questions and answers for you about the COVID vaccine. Stay tuned. Welcome back. As you've heard, we are starting to see new variants of the COVID-19 virus in the U.S. Many of you have asked us if the COVID-19 tests will detect them. Crystal Cruz went to verify.
We're talking about tests for COVID-19 today and whether they'll work on new variants of the virus. So why are we talking about these? Well, there are now 3 variants in the U.S., one from South Africa, one from Brazil, and one from the UK. A viewer asked us if the existing tests would still detect these new COVID variants. So let's find out. Our sources are the CDC, the FDA, the WHO, and Dr. Stuart Ray, a professor of medicine at Johns Hopkins. Dr. Ray explained that, quote, the diagnostic tests currently in use seem to detect these newer variants so far. The CDC explains further that current PCR tests have multiple targets to detect the virus, so even if a mutation causes a new variant, the tests will still work. So yes, if you have a new variant, the test will show positive for COVID. But Dr. Ray explained that they won't tell you which variant of the virus you have because, quote, sequencing of the virus to determine what variant it is remains relatively uncommon, end quote. So back to the question, will current diagnostic tests still detect new COVID-19 variants? Right now, the answer is yes. Our experts say the COVID diagnostic tests are still working to detect COVID, but they are continuing to test them on new variants in case that changes. With your Verify, I'm Crystal Cruz.
Thank you, Crystal. Another one of the questions that we get on a regular basis is this. Why can I not get the COVID-19 vaccine if I have tested positive in the last 90 days? Val Sparks with Midland Health told me since they have a limited number of vaccines, they are asking, per CDC guidelines, that anyone that has had active COVID-19 defer their vaccine for 90 days to save it for other people.
It is believed that if you have had COVID-19, had a test positive, had your symptoms, and recovered, that you have your own natural antibodies. And at this point, your antibodies are good for coverage and you won't need the vaccine immediately. So it is saving the vaccine for those that are in more need than you are within that first 90 days.
A medical center, on the other hand, is handling that question a bit differently. We hear from Chief Nursing Officer Kristen Timmons.
That is and was a recommendation whenever the drug just first had come out, but we see a lot of people get it. We've also heard a lot of people respond back to us and tell us that the closer they've had COVID as far as recovery, the more severe their symptoms are after they get the vaccine. Higher temperature. In fact, some have told us, I felt like I had COVID again without the respiratory. So it's really attacking your immune system. And so, but people are definitely coming just weeks after having COVID.
Now, as with any medication, there are possible side effects with the COVID vaccine. Not everyone will get them. Some may get them more than others. Here is what you should look out for. You could experience fatigue, muscle pain, especially at or near the injection site, fever, and chills. Surprisingly, it is because of these side effects that 30% of people who get the first dose may choose not to get the second. Now, there are some new developments as far as the vaccination hub in Midland is concerned. We're going to share those with you now. There will be a second vaccine site starting February 15th. That is Monday. It will be located at the Golf Course Road Church of Christ Family Center. But be advised, this will only be for those who need their first dose of the vaccine. The site at the Midland Horseshoe will stay open, but as of the 15th, we'll be shifting to giving out only second doses of the vaccine. So if you got your first dose at the Horseshoe, that is where you will go for your second after you make your appointment. As for Odessa, they're still working out of Ratliff Stadium, but they are looking to expand and make the vaccine available to more people who can't make the drive out of town.
We know everybody can't make it to Ratliff Stadium. We know that. We have a plan. You know, sooner or later, we're going to have to leave Ratliff Stadium. We can't stay there forever. And when we start rolling this out to our clinics around town and then with our partners, it'll be available in more places than just Ratliff Stadium. Kristen?
No, that's absolutely correct. And over the next week, we'll begin rolling out some other things for the media to help us distribute to people that can't come to Ratliff. We're really partnering with Easy Rider. And as Russell said, we're looking at different churches in various areas so that we can go pop up a tent or a trailer in those areas and take our Ratliff setup on a smaller scale to all four corners of our county to make sure we cover everybody.
That is definitely good news on more vaccine availability. Don't go away. We're going to take a short break and come back with some more important information for you. Welcome back. You have heard repeatedly the names of the two vaccines being distributed here in West Texas. They both do the same thing, but they're not actually alike. Tatum Gwynn explains.
The Pfizer and Moderna vaccines have a lot in common. Both require 2 doses and both were made using mRNA technology. Both are about 95% effective, but they are different in one key area: storage temperature. That difference will impact who gets which vaccine. The Moderna vaccine must be kept at -4 degrees Fahrenheit. That's about as cold as your typical freezer. The same place that you keep your frozen foods and ice cream. You know what I'm talking about. Now, the Pfizer vaccine, it requires extremely cold temperatures. More like -94 degrees. Yeah, that is colder than winter in Antarctica and way too cold for your typical freezer. The Pfizer vaccine requires special ultra cold storage, and you can't just get that at an appliance store. That is also why urban areas and large hospitals with more ultra cold storage will get more of the Pfizer vaccine, and rural areas will get more of the Moderna. Victor?
Interesting. Thanks, Tatum. Now, at this point, some of you may still be on the fence about whether or not you want to get a vaccine. Here's another breakdown of how many people in Ector County already have gotten theirs. As we said earlier, last week, nearly 4,250 shots were administered at Ratliff Stadium, giving them a total of just under 13,000 in the first 2 weeks. Now, that's not including the number from Wednesday. Once the weather clears up, vaccinations will continue on Wednesdays and Thursdays from 9 a.m. until 3 p.m. at Ratliff Stadium. Of course, there are tentative plans to have it on Fridays. That is, if they have vaccines left over. Second doses are not being given at Ratliff Stadium. Those will be by appointment only, and you can call MCH at 640-2747. Now, as you can imagine, they are getting overwhelmed with phone calls. MCH asks that you please be patient with them. Someone will eventually get to you and set up your appointment for your second dose. In Midland, more than 22,000 vaccines have been administered as of Tuesday of this week. MMH has given some of their vaccine allocations to Garden City last week, where 200 people got the shot. A total of 900 vaccines went to Fort Davis and Marfa this week. Hospital officials tell us more people are actually coming out of the county, even as far away as Dallas. MMH is also offering the vaccine to staff at MISD and Midland College. This is due to the previous no-shows. Luckily, the no-show number is going down and no vaccine is being wasted. Well, the vaccination clinics in Midland and Odessa could not go on as smoothly as they do if it weren't for the numerous volunteers. Both teams that I spoke to can vouch for that, but they can still use more help. In fact, anything and everything you are able to help with. If it's your personal time, drinks, snacks, or even a monetary donation, they'll gladly accept it. If you want to or can help in any way, in Odessa, you can email them at volunteers@odessa-tx.gov. In Midland, you can email them at vacvolunteers@midland.org, or you can call them at 432-312-0030. We will be right back with some closing remarks. Stay with us. Before we go, health officials want to remind you of one important thing. Just because we're getting vaccines and positivity rates and hospitalizations are dropping, that doesn't mean we're out of the woods yet. Dr. Wilson reminds us that we are still a long way away from herd immunity, and sadly, the virus is still out there. That is why everyone is urged to keep doing what you're already doing. Keep wearing your face masks, keep washing your hands, and maintaining social distancing, as we have been doing up to this point.
We feel optimistic and happy to see where we're at today, but it's because of the continued sacrifice, hard work that everybody's done, and we ask you to stay on that course for a while longer.
We certainly hope we've answered your questions about the COVID vaccine. If there is something else you want to know, there are links to both Midland Memorial and Medical Center on our website. Log on to newswest9.com and click on the vaccine tab. Thank you for joining us. Stay safe, stay healthy.